Hello, and a very warm welcome to this Combat Stress webinar, Psychologically Informed Support for Care Home Teams during COVID-19. I'm Dr. Jen Bateman. I'm a clinical psychologist at Combat Stress, and I'm really pleased to be spending this time with you today, thinking about how we can support ourselves, our colleagues, and our teams during these really challenging times that we're living in. So I'm the member of the team that is sharing this information with you, but I really want to say a great many thanks to the range of interdisciplinary colleagues that have contributed to the development of this material, including occupational therapists, clinical psychologists, and psychiatry colleagues. So a great many thanks from me to my colleagues for their support in developing this material. So what are we going to be thinking about in our time together today? Well, I'm going to be beginning by sharing the unique challenges experienced by care home workers during the times of COVID-19. And I'm going to be sharing some frameworks to guide you to understand the range of emotional responses that you and your colleagues are likely to be experiencing at these times. And I'm going to be sharing some ideas about how you can support yourself and your colleagues and team members, but also, just as importantly, knowing the signs of emotional distress and when it is appropriate to refer yourself or support a colleague to refer themselves for further psychological support. And I'll be helping us think about how to do that together today. So this webinar is educational in nature. I'll be sharing a range of ideas with you, but I'm also going to be offering some moments of reflection. And, you know, we know that you're very busy, and taking time out of your busy schedule to attend a webinar like this is a really important learning opportunity. So I want to give you the opportunity to reflect specifically on some of the themes that we'll be thinking about together. So we've included some moments of reflection, and you can use these in whichever ways you would like. You may wish to pause the playback of this webinar to jot down your thinking at the time, or you might want to use those reflection exercises at another time with your colleagues as you apply the information that you're learning in your teams and your workplaces. So with that in mind, I've got the first moment of reflection to share with you, and that's really to take stock of where you are personally and professionally as you navigate COVID-19. Firstly, I'd love to invite you to share, to reflect on what you're doing, what you have been doing well, and what you're pleased about in terms of the way that you've been coping in these difficult times. What has been going well, personally, professionally, or both? But also, I really invite you to use this as an opportunity to think about what you need support with. What have you found really difficult to navigate? Where are the gaps in feeling secure as you anticipate navigating the weeks and months ahead? What do you still need support with? And I think bringing these ideas to mind as we kick off this webinar will be a really good opportunity to make sure that you can get what you came for today. So let's begin by thinking about the unique challenges experienced by care home workers navigating a pandemic situation. So this is a slide that shares just some of the challenges that you may well be experiencing, and this is drawn from the COVID-19 Trauma Response Working Group paper, which you can find at the web link shown on this slide. So as frontline workers, care home workers are absolutely vulnerable to infection, and you may well have had fluctuations of concerns about the PPE that you've been provided with and whether or not that is adequate. And we know that PPE can make communication and connection more difficult with residents who may already be challenged and vulnerable when it comes to clear communication. You're likely to be a member of staff that is very experienced with dealing with loss and grief as part of your work in the care sector. However, the multiple experiences of losses and grief that you are likely to have been experiencing during these times, coupled with the absence of those usual ways of saying goodbye, can be really, really difficult to navigate and can interfere with some of that natural grieving process that we know that we need to do when we lose residents that we're supporting. So you are a trained and experienced worker, but the particular demands required with an infection such as COVID-19 mean that the demands of high care associated with this may outstrip your training and experience to date. And linked with this, there can be a very real need to make difficult moment-to-moment decisions where there are no clear-cut right answers. And that can be very, very difficult to navigate over time. And you're likely to be experiencing greater personal demands than usual. This is a pandemic that is affecting you personally as well as professionally, and you can't just close the door on the demands of this pandemic once you finish your shift. You then return into your community, into your family environment with a whole range of additional personal demands to deal with, whether that's supporting children who are at home more than they were, whether that's caring for family members, perhaps additional financial concerns. There's a whole range of stresses. So whilst home life should be a sanctuary from the demands of our day-to-day jobs, actually you might be going into another period of needing to make stressful and difficult decisions, and over time that of course takes its toll. So this is just a taste, really, a flavour of just some of the challenges that care home workers are likely to be experiencing. So I'd like to share with you some ideas about understanding the range of emotional responses to a pandemic situation. So of course, we're living in unprecedented times and you are doing unprecedented work. So it is okay not to be okay. It is completely natural response to have a range of emotions in response to what's happening right now. And you're likely to be experiencing a higher range or a broader range of emotions than usual. And you're likely to see the manifestation of high emotions more often in the colleagues that you're working with. And, you know, emotions are really important. They've evolved in us as humans for really good reasons. They provide us with data about what's happening for us internally. And all emotions are important and have value. You know, I think traditionally we've thought of emotions as kind of positive or negative, but actually all emotions have a huge amount of value, and actually it's often those negative emotions, traditionally what we might call negative emotions like anger or upset or distress, that are actually really, really important to pay attention to, because they're showing us that we've likely reached the kind of limits of what we're able to cope with, and they're a really important sign or indicator that we are likely to need more support than we're currently getting. So with that in mind, I wanted to share with you the feelings wheel. And again, I have the reference for this at the bottom of the slide if you'd like to download your own copy of this wheel, because this really is an attempt to visually depict the multitude of emotional experience that we as human beings have been equipped with. And I haven't actually counted how many emotions are in this wheel. I think I got to 100 and gave up. It's certainly more than 100. And it's really a tool to highlight the range of emotions that we have the capacity to experience, but also to give us a greater vocabulary to describe our emotional experience. Because, you know, I think we all have a vocabulary to describe our feelings, but oftentimes it's limited. And this tool can really be something that you can share with your colleagues and your teams in order to really get into some of the more subtle expressions of the movement between these emotions, and it can really help when we're communicating about how we're feeling to make use of a tool like this. Another model that I want to share with you is the stress bottle, and this is an attempt to describe the fact that we as human beings have a limited capacity to deal with emotions. We, just like a bottle has a capacity, and when we keep pouring liquid into a full bottle, it will overflow. The same is true for us as humans. You know, we have often a high capacity to deal with emotions, but there is a limit, and we will eventually reach the limits of our capacity to deal with emotions. And many of us, just through the demands of living with everyday life with its competing demands and stresses, we often already are walking around with half full stress bottles, you know, dealing with financial worries or family concerns or health concerns or, you know, issues and traumas from the past. You know, all of this takes up emotional energy and headspace. So is it any wonder then, when we're navigating times of a pandemic, that our stress bottles are becoming very, very full? We have, you know, certainly you will have greater distress in your workplace to contend with. There's demands of limits on our movement in terms of lockdown. There's stresses at home, family, kids, older relatives potentially. There may be more financial strain than usual, and you're likely to be experiencing grief, particularly in the workplace, more frequently than usual. And so with these very full stress bottles, it then only takes a small drop. Just at the top of that image, you can see that small drop of everyday stress where we've just reached our limits. And so that stress, that everyday stressor that oftentimes we could just take in our stride and bounce back from, actually that's then the trigger for some of these signs and symptoms of an elevated stress response. And see if any of these are familiar to you in terms of your experience over the last weeks and months. A sense of a lack of motivation or a lower level of motivation than usual, perhaps feeling more tearful or low, more nervous or panicky than usual, perhaps a greater sense of irritability or a tendency to snap at others. You might have found that your concentration has been affected, or your memory or decision making. And your sleep may have been impacted. You might have trouble sleeping, or you might be waking up earlier or through the night, or be unsettled in your sleep. You may have noticed changes in your appetite. So if any of these have been familiar or have been around for you in the last weeks and months, like, know that that's absolutely a natural response to feeling more overwhelmed than usual. And you'll see on this image there is a tap, and really in order to support our capacity to tolerate these stresses that we're experiencing, we need to have ways of turning on the tap and releasing some of the stresses that we're experiencing. And so as this presentation goes on, we'll be sharing some ideas about how you can turn on the tap of your stress bottle and release some of these stresses so you can feel more able to cope than previously. So let's move on to think about how we can provide psychological and emotional support to staff during COVID-19. And I'd like to share with you a model that's been developed by the British Psychological Society in their guidance documents for psychological professionals during the COVID-19 pandemic. And you can find the reference for this very helpful guidance document in the reference section at the end of this presentation. And they really recommend that a stepped approach is recommended for providing support to our staff. So at the bottom of this pyramid of support that we can provide, the first but most important in many ways, the foundational piece of support that we can provide are support around how to get basic needs and physical resources met. So these are this would be guidance about how to keep safe from the pandemic, how to use PPE and equipment safely, and really important physical aspects of the working environment in terms of making sure staff have their basic needs met in terms of regular rest breaks, in terms of meal breaks, good quality foods and hydration, and information about how we can provide care in this pandemic. So I've no doubt that you're already doing absolutely everything you can as an organisation to ensure that your staff's basic needs and physical resources are met. The next layer of support that we can be providing to staff is information, and this is information about absolutely about COVID-19 and the organisational approach to keeping staff and residents safe, but equally information about emotional well-being. And you may well have already been signposting your colleagues, your teams, to information about how they can access emotional support in the workplace and in their personal lives. And we've got some recommended information sources towards the end of this presentation. So I'm assuming that you're already doing these lower areas of this pyramid really expertly already. So really the focus of this presentation is to think about how we can provide support, emotional and psychological support, or what we may want to call psychological first aid. And a proportion of our workforces will need extra emotional support, and there will be a small but significant proportion of our workforces that will need psychological intervention in order to really cope and navigate with across COVID-19 in the form of perhaps one-to-one therapy. And again, we'll be talking about that as we go through. So before we think about these practical ways that we can support our colleagues at the top of that pyramid, I wanted to share with you a guidance document that has been developed to describe the 3 phases of psychological response in healthcare workers. And this again has been drawn from the British Psychological Society guidance document, and it is based on the psychological responses that have been seen to have been experienced in previous pandemics. And so we can be confident that this is evidence-based and likely to be occurring in COVID-19. So those 3 likely phases are preparation, action and recovery. So the first phase, phase 1, is the preparation phase, and this is where there is anticipatory anxiety that a pandemic is coming. So this is often a really rapid phase, and certainly in the COVID-19 pandemic, it was often felt as a very, very rapid phase, because there was planning happening often at a high level in a rapid time frame. So there was a lot of anticipatory anxiety about the unknown. And because there is limited time to plan and limited input into this preparation phase, many staff who aren't involved in that high-level planning may feel quite anxious and often report feeling unprepared for the outbreak. So there's a lot of fear, uncertainty, and anticipatory anxiety at this stage. Now, phase 2 is the action phase, and this is divided into action phase 1 and action phase 2. So action phase 1 is when the pandemic has become live within our workplaces, and the experience that is likely to be felt here is what we call heroics and surge to a solution. So there is increased camaraderie at this early phase because staff are crossing boundaries, they're working together, they're really surging to the demands of the situation. And there's a sense of rising to the challenge, and actually that there can be quite a lot of sense of well-being that can come with that, and feeling that one is playing their part in tackling this crisis. However, staff may respond on instinct at this stage, and they're more likely to be prone to error, and they likely lack the headspace to see all the options. And of course, staff will be witnessing things that they haven't seen before, and this will lead to a feeling of being out of control. And staff will also often lose their boundaries over working hours and breaks, and they may well start to overwork as a response to trying to manage and deal with the high demands that are occurring. And of course, work-life tensions will be likely to arise because family life will also become unsettled. You know, as we've said, care home workers will leave their shift and then they'll be thrust into their families, into their communities, where they have to juggle many competing priorities: children, caring for family members. And this can be really, really challenging because that usual break time and restoration that comes with home life has become limited, and there isn't that usual time to rest and recoup. So the second phase of the action phase is where this adrenaline that has fueled those earlier stages inevitably has to give way to an exhaustion. And this is actually the period of highest psychological risk because staff are often in this full go mode. There's high levels of adrenaline and automatic pilot, and they then experience this sudden exhaustion, and as a result may neglect their physical, their psychological self-care as they feel it's not the priority. And at this stage, moral distress and moral injury are a risk as healthcare becomes limited and people are unable to act or respond within their own moral or ethical code, and death and dying might not be handled in the way that it usually is. So those usual ways of grieving, of saying goodbye, may not be possible, and this can cause a lot of internal conflict and dilemma. And naturally, staff, with the exhaustion at this stage, staff may begin to feel emotionally disconnected from their work and experience compassion fatigue. And they may engage in avoidant or unhelpful ways of coping. So this is a period of high risk, particularly to those members of our staff who have pre-existing mental health vulnerabilities. And we really need to be highly aware and acutely aware of those individuals in our workforces that we know have pre-existing vulnerabilities in terms of mental health, and be ready to offer extra support and outside support if need be. So phase 3 then, the final phase of psychological response to a pandemic situation, is recovery. And this is where the pandemic has started to ease somewhat and staff start to have time to reflect. And for many of our team members, they will be able to integrate the experiences of high stress and demand using their existing coping skills and drawing on their usual ways of navigating difficulties, using their family, using their support networks, and then perhaps religious and community sources of support. So most staff, thankfully, will be able to cope successfully using their own preferred style. And indeed, many staff may report being changed by this experience in a positive way. They may talk about experiencing a sense of personal development, and post-traumatic growth may well be one of the consequences, positive consequences of these very difficult times. But we know that there will be difficulty at this time because there can be what we may call cognitive dissonance with the hero's narrative. You know, it's been wonderful to see how we have had the clap for the carers and really the British public getting behind our care and support staff. However, some care workers will find this really difficult when they feel that they haven't always made the decisions that they're proud of. You know, they may have had to make really difficult decisions, often because of organisational needs and demands. And so there can be this disconnect between feeling like a hero and their experiences. And this can cause some quite natural resentment towards their organisation, who were needed to make these decisions within limited timescales. And we will expect there to be a proportion of our workforces that will have difficulties coping at this time. Some may experience intrusive thinking, shame and guilt about what they should have done differently. And there may well be risk of long-term mental health difficulties. And so we need to be on alert that there will be a proportion of our workforces that will be likely to be at risk of psychological difficulties, including but certainly not limited to burnout and post-traumatic stress. So I'd like to offer you another moment of reflection. I've shared a lot of information with you there about those stages, and I wanted to invite you to reflect on those stages. Do you recognise them in your work to date? And where do you feel you and your staff and team currently are in terms of those phases? Are you in phase 1, phase 2 or phase 3? And linked with that, you know, what do you need now? What do you need individually as an employee? What do you feel that your team and your colleagues need, particularly given the fluctuations of the stresses brought on by COVID-19? So I'm going to pause for a moment to invite you to do some of that reflection and absolutely consider discussing and reflecting with your team and colleagues after this webinar. So we talked earlier about this stress bottle of as a model to help us understand how we often have limits to our capacity to tolerate and manage stress. And I talked briefly about the tap that we can see in this image, and the benefits of having ways to start to release some of the stresses, so we can begin to feel like we are managing our range of emotional experiences. So I wanted to share just a few foundational ways to start to turn on this tap and manage stress levels. and you can see them here in this slide. Make sure that you are doing what you can, both you and your colleagues, to get your physical needs met in terms of eating, drinking and sleeping properly. Maintain a routine. Ensure that you're having regular breaks during your shifts and time out between shifts, and really do make sure that you are having proper breaks and not using that time to catch up or do other work-related tasks. We all know the benefits of exercise and physical activity, so do what you can to ensure that your routine, your daily routine, includes engaging in some physical activity. It's good for your physical health, it's also good for your emotional health and well-being. And life is difficult when you're caring for others, so absolutely make sure that you do what you can to plan regular activities that make you feel good. We need a balance of work, rest and play, and the play is the one that often gets sidelined, but ensure that you do have ways of playing, of feeling connected with yourself in a way that feels good, and have a range of pleasurable activities that you can engage in your time off. And some of this might include social time, and absolutely do what you can to stay in touch with friends, family, of course, within the limits of social distancing guidelines. And it can be really tempting to use coping strategies like increased alcohol, smoking, and of course that's a natural response to trying to take care of yourself. But of course, in the long term, we know that these aren't helpful and they aren't the best ways to prioritise your well-being. So if you can, try to replace these less helpful ways of coping with more supportive ones. And you might want to limit the time that you engage with news, with social media, if you find it activates a sense of worry or anxiety. Having boundaries with yourself about the number of news sources that you engage in, and making sure that you prioritise trusted news sources, and maybe just limiting it to maybe 1, 2 or 3 check-ins each day, before a while before bedtime, so it's not on your mind as you're trying to wind down towards sleep. And just put limits on the amount of time that you spend engaging in news if it's anxiety provoking. Set a timer for 10 or 15 minutes if that's helpful to you. Just do enough to keep yourself updated, but without causing that negative impact of information overload and worry. And do what you can to have a range of activities that does take your mind away from the current crisis. Oftentimes we default to watching TV and watching Netflix, and that's great, and there's nothing wrong with that, but oftentimes we can find our mind wandering when we're engaged in those kind of activities, and our minds can wander to worries, so that we've kind of got this difficulty where we're on the face of it engaging in relaxation, but actually our mind is still as busy as ever. So finding ways of keeping up with hobbies, of time with partners, family, friends, these are ways that will be more refreshing and give you a sense of renewal in your time away from work, so that you can then return to work feeling stronger and more resilient. So those are just a taste of some of those ways you can turn on the tap to manage your stress levels. So let's move on now to think about recognising the signs of anxiety and emotional distress in yourself, in your colleagues, so that you can be aware of these and know when a colleague may need further support. So this slide just gives a flavour of some of the signs that a colleague may need more emotional support. Appearing more anxious or on edge, more prone to irritability or anger, seeming lower in mood than usual, seeming more withdrawn, being more forgetful, having little interest in doing things that were previously found enjoyable, reporting fatigue or lethargy, or that they're having trouble relaxing or sleeping. You might notice a greater sense of self-criticism or a sense of hopelessness. You might notice that the person seems to have trouble concentrating or be less productive. They might have they might be showing more cynicism or resentment or finding fault type behaviour than you remember from previously. And you may notice a change in their work patterns. Perhaps they're starting late or leaving early or working excessively long hours. And they may well be using alcohol or substances more often to cope, and you may see signs of greater use. But of course, you will know your colleagues better than anyone. So really, the invitation is to just be on the lookout of changes to what you've been used to seeing in your colleagues. And really, I invite you to have a fairly low tolerance level to checking in with a colleague around sharing your worries, sharing that you've noticed that they seem to be behaving or feeling differently than usual, and we'll think more about how to do that. So this slide is about kind of colleagues that you are working with and how to open up this conversation. So if you notice a colleague is showing signs that cause you concern, do be willing to have a conversation with them and do what you can to make sure that's a one-to-one conversation, that it's in a private, quiet space where you won't be disturbed. And ask a really simple question. How are you doing? You might want to share some of what you've noticed. I've noticed that you seem a lot quieter than you usually are. How are you doing? And listen actively and show empathy. And absolutely discuss the advantages of seeking extra support at this time. We have absolutely no qualms of supporting colleagues if they complain they've got a sore back or they had a physical injury. We absolutely wouldn't shy away from saying, oh, have you booked an appointment with your health professional to get that checked out? I think we really need to move towards having the exact same reaction when we are talking about emotional well-being and emotional concerns, and to really normalize this, and I encourage you to share. This is a difficult time for all of us, and we all need to do what we can to promote mental fitness as alongside physical fitness. And of course, if you're unsure about what to advise, that's absolutely natural. So seek help yourself if that's you. Have a chat with your manager, with your supervisor. 2 heads are better than one. Share your concerns in confidence and get some advice. And of course, whenever you're giving support and emotional support to a colleague, remember your own self-care. It's really important to recognise that it demands emotional energy to have these kind of supportive conversations. So take care of yourself. If you are upset following some of these conversations, that's okay. Seek out another colleague that you can seek, that can be a sounding board, and find ways of building yourself up and giving yourself some time and space to do that following these difficult conversations. So let's now think a bit more formally about the recommendations for supporting care home workers during COVID-19. And these next 2 slides are drawn from the COVID-19 Trauma Response Working Group guidance, and they really have a range of documents that are designed specifically for supporting care home workers. So if you haven't already sort those guidance documents out, I do really recommend you visiting the website on this page and having a read of these documents. So these first level needs are really what we've talked about. It's really important that we provide information about basic needs around PPE, around food, rest, shift patterns, and support individuals who may be having greater financial insecurity than usual. Giving information about COVID-19 in a way that's brief, clear, honest and accessible, and providing extra training as needed. And you may want to consider the ways that you are setting up social support and communication in your workplaces. Do provide regular, clear and accurate information for staff, and encourage informal peer support. You might want to think about the possibility of a buddy system where staff members are paired up and have kind of a particular role to be on the lookout and particularly check in with their buddy on a regular basis. And do set up regular feedback mechanisms and ensure feedback is acted upon. And this really supports staff to feel a sense of connection and feel like their concerns are being listened to and heard and acted upon. So the next level of support is psychological well-being, and do what you can to provide compassionate and supportive management. Pay attention and listen to staff, and do what you can to really highlight and recognise excellent work and appreciate the work that's being done with positive feedback. Strive to be understanding when things go wrong under pressure, and normalise but don't minimise distress. So become aware of what support services are available to staff in your locality, and inform staff about these services and encourage them to access help if they need it. And enable staff to access appropriate online resources, helplines and wellbeing apps. And in a slide that's coming up, we've got some resources to share with you. And, you know, if you're a leader or a supervisor or a manager, you know, you're a role model. So absolutely do what you can to role model appropriate self-care, you know, share your experiences of navigating COVID-19, positive and challenging, and acknowledge difficulties and celebrate good practice. So the next level of support is grief and bereavement training and support. And of course, you will already have a high level of expertise in terms of managing grief reactions and bereavement. But as we've shared, you know, this is an unprecedented time where there's likely to be many more losses than there are usually, and staff may well find this quite difficult to deal with. So do what you can to make information about the bereavement and services to support clearly visible and available for staff, for residents, for family. Include information leaflets, support lines and online services. And encourage your staff members to reminisce about the residents that have passed after they've died, and do reassure them of the value of the end-of-life care that they were able to provide. And finally, last but certainly not least, I absolutely wonder if this should be higher up in the list, but encourage self-care. So as we've said, you know, we've come full circle about maintaining structure and routine outside of working hours, prioritising good quality sleep, rest and recovery, and continue to get daily exercise and engage in enjoyable activities. And as we've said, you know, connection with family and friends is really important, but also disconnection and time out and time away, especially from media, social media, news, as and when needed. So this slide really just fleshes out some of what leaders and people in positions of responsibility over staff members can be doing to provide additional emotional support to colleagues and team members that they're responsible for. So role model self-care and do what you can to share your experiences of the crisis and acknowledge difficulties, but also celebrate good practice, and really might be tempting to overlook some of those usual ways of celebrating good practice, but this is the time to absolutely continue and be grounded in some of these routines that are helpful for teamwork and cohesiveness. And provide compassionate and supportive management by letting your team know that you're available for them, that you're here to listen, and that you are here to attend to their emotional well-being as much as their physical and work-life well-being. And do be understanding when things inevitably go wrong under pressure, and see these as learning opportunities, and encourage a constructive stance on team learning under pressure. There may well be a requirement to make difficult decisions in the moment, and not all of those decisions will have the outcome that we really wanted, and that's okay if we can learn from these experiences and implement a change in practice going forward as needed. And do enable your staff to access online resources, helplines and wellbeing services, and know what's available in your local area to inform staff. So what might some of that compassionate communication look like in practice? Well, this slide really is an attempt just to give a taste of some ideas of how to provide that emotional support in the form of sound bites for you to adapt to your style of communicating. So these are just ideas. So do what you can to dispel any feelings of failure, blame and shame. And you might want to do that by saying things like, I'm here to support you. We'll find a way through together. So you can show empathy and empathic willingness by saying things like, what we're going through right now sounds really tough. And normalise the expression of emotion is healthy by saying things like, you've been through such a lot. Thank you for sharing this with me. And then invite questions about what needs to happen. So what can we do to best support you? You could perhaps ask what needs to happen for you to feel more at ease, and maybe invite them to reflect on what's helped them in the past when they've had to navigate difficult emotional experiences. Oftentimes the people that we're working with have had a number of life stresses that they've had to navigate in previous years, and asking a question like this really taps into that reflection mode to think about, what were the specific things that helped them get through in the past? Was it extra social support? Was it taking some time out? Was it asking for psychological support or getting external space in order to do that reflection? And amidst all of this, absolutely consider and check in regarding the confidentiality of the information shared, and consider your own organisational needs regarding wellbeing and record keeping. And I suppose throughout all of this, really the take-home messages are to foster the strengths of your team. You will be the expert in knowing the particular strengths that different team members have, and you may well find ways of allowing strengths of team members to shine through in these difficult times. And there's much of this pandemic that we can't control. So really the invitation is to focus on what we can control. Often that's quite a limited amount of agency, but it's important for our sense of safety and security that there are things that we can control and that we focus on those. And throughout all of this, the invitation is to be kind to yourself as much as to your colleagues. Have compassion if you're struggling. And be kind to yourself. Talk to yourself in a kind and caring way. We often have inner critics that where we talk to ourselves in a way that we would never talk to a family member, a friend, or a colleague. So tune into the kind of way that you're talking to yourself during this time, And be compassionate. Talk to yourself like your own best friend, and absolutely, if you need support externally, then get that for yourself. And we'll think more specifically about that in a moment. But before we do, I wanted to just offer a flavour of some of the services that we've been recommending to organisations that we've been supporting over this time. No doubt that many of the organisations that you see on this slide will be familiar to you, but there may be some new ones. There may be ones that you're already offering to staff that have really a library of services that you can signpost your colleagues and your team members to be able to feel supported and to get ready access to information and support. So the final piece of this section of the presentation is highlighting that there will be a proportion of our workforces that absolutely will need to access psychological support in order to cope with the difficulties that they're experiencing of navigating the demands of COVID-19. So if you do have concerns about your colleagues' emotional well-being, do encourage him or her to speak to their GP and seek a referral for appropriate psychological support. Psychological support is available throughout the UK in NHS services in the form of time-limited therapy for common mental health problems such as depression and anxiety. So encourage your colleague to ask their GP for a referral for psychological support. Many of these services are called IAP services, improving access to psychological therapies, and many areas also have online self-referral options. So if you go to the internet and you find your local NHS health service, you will often find links to their psychological therapy self-referral, where you can fill in a simple form, and you don't need to access a GP in order to get that. And of course, if your colleague tells you that they have had any thoughts of harming themselves or indeed anyone else, do what you need to keep them safe. Accompany them to their GP so their mental health can be assessed by a health professional, and of course accessing help via NHS 111 online or via phone is also an option, and call 999 if they are in immediate risk to themselves or others. Now, I wanted to say just a few words about staff to resident support, and of course this is a webinar all on its own, but I wanted to just briefly share that of course we know that residents will need greater support during this time, and I wanted to invite you to consider creating small working groups across the sites of your organisation so that staff can share best practice and learning about overcoming specific challenges they may be encountering. And here is just a flavour of some of the challenges that are likely to be arising for you. Working in a person-centred way whilst wearing PPE, feeling underprepared or under-resourced for the level of nursing or palliative care residents may need, residents feeling more lonely or anxious or depressed at this time, and finding it difficult to adjust to the online contact with loved ones due to social distancing, and of course the increased frequency of dealing with the loss of residents and needing to break bad news to family members over the phone rather than in person. Now, the website on this page has a range of guidance documents that can really help structure some of the conversations that you may want to be having in these small working groups. So I've shared a lot of information with you today, and I want to pause to give you a moment to reflect. And I really want to invite you just to maybe think about the top 1, 2, or at most 3 things that you feel are next steps for either yourself, your colleagues, or your team. And I want to invite you to perhaps jot that down, or perhaps make a note for yourself about the next steps in terms of what support is needed beyond the time that you've spent in this webinar. So thank you so much for spending this time with me today, and I really want to encourage you that this is an extremely difficult and pressurized time, and the take-home message really is to do the very best you can and be kind to yourself, and I think that is often one of the hardest directives that we can give when we have high standards of care, high standards of performance for ourselves and others. But this is a difficult time and it will be a struggle, and being kind to ourselves is a really important way of fostering our resilience and our ability to cope. And so I really hope that there has been something that's been useful that you found in your time with me today. And I'd love to invite you just to focus on that one thing. You know, one is often the best number, and one thing that you can take forward in order to implement something of what you've learned today. At Combat Stress, we're always really keen to seek feedback and evaluation. So I'd like to invite you to follow the link on this page and complete this training and evaluation form if you may. And I wanted to leave you with a number of key resources that have been highlighted in the training today. A great many thanks to all of the authors who have worked at pace to develop this guidance throughout this pandemic. And these are really valuable and informative guidance documents that I think that you will find useful. And here are the references. Again, these are all available online, and I encourage you to seek these out and use these as you see fit. So it only remains for me to thank you for joining me today. A sincere thank you to all of the authors who contributed to the resources and guidance documents referenced within this training, and particular thanks to my colleagues named on this slide for their input and support in the development of these training materials that I've shared with you today. So thank you so much for joining me today. I really hope that you found this information useful and that you've been equipped with one or two ideas to support you in the weeks and months to come. It only remains for me to say a sincere thank you for all that you're doing to provide support in these challenging times, and for spending this time with me today. And I want to wish you all the very best in the weeks to come. Bye for now.